We are now joined by Constance Mathe, Asijiki Coalition National Coordinator, to expand on the discussion. A very good evening to you. Thank you so much for your time. Renewed calls for the bill to be fast-tracked as we listen to some of the reasoning around it, as many within the sex work industry are saying that it's hindering the progress of their overall lives. And it's also a way to ensure that there is safety and the streets are not full of underage sex workers. Talk to us about the importance of this bill.
Right. The bill is very important for the sex workers because the decriminalization is the only best suitable model for the sex workers, especially looking at the South African context. It is the suitable model and facing the challenges that we are facing on the sex workers on the ground. Right. The Ballito won't gonna bring a golden opportunity. The decriminalisation won't gonna bring a golden opportunity, but it's a milestone step since we have been advocating for decriminalization of sex worker for the past 26 years. Once the bill is there, at least the sex workers, they will be protected and they will be protected by the law, and also they can be able to exercise and practice their human rights, and also there will be less stigma and discrimination in the industry, and also there will be protection on the gender-based violence, as we know that as a country this is the major thing that we are facing. There will be reduced of gender-based violence and able to kind of report the cases, and they will be able also to assess the health services and the justice services like any other citizens. The decriminalization of sex worker also...
If you'll allow me to interrupt you, Constance, are you saying that there is limited access to health services? I mean, do you come into a hospital and talk about your work, or are you just a patient wanting to get treatment?
Right, you're a patient, you just want a treatment. But as we know that some of our colleagues who work in the street, they are street-based sex workers. So as the people pass, the time goes on, they will know them and they will identify them. Let's say the sisters in the hospital, they see you, they pass in that road every day, they see you. When you go and seek for services, definitely they'll know it's you there in the street, you are a sex worker, and they start calling you names. And then the other thing, you cannot go back to hospital and say, I have STI. Then most of the times when you arrive at the hospital and say, I've got STI, and then they will ask you, bring your partner. Now you don't know, the partner is a client. You just did business, is gone. And then the other thing, the thing that they does is like, why are you keep on coming in hospital with STI? They just assume you're a sex worker. So those kind of stigma and discrimination that goes and come with it, it makes the sex workers to be scared to access the services and go to the clinic because no one wants to be exposed, or anyone needs to be stigmatized. So they feel so scared to access the services, and they prefer to go to the mobile clinic from NGOs.
Let's talk a little bit about discrimination. I mean, you make mention of gender-based violence. Of course, we know it's what President Cyril Ramaphosa has spoken of as and described it as the second pandemic. What is the link when it comes to gender-based violence and discrimination for sex workers?
Sex workers are mostly likely 17 times murdered than other women. Sex workers recently now we had a case in Joburg, everybody saw because it went viral and it was in High Court. Everybody knows about that.
Yes.
6 women were murdered and their bodies they were found in the garage. This is how sex workers, those are the bodies that they were exposed. We are not talking about the one that they haven't come out and be exposed in public and go viral. So sex workers, each and every time, you when they go out, they never know whether they are coming back or they are not coming back. Sex workers are facing the gender-based violence, even in their partners. The partners as well, some of them, they also violate their rights and they abuse them. There is sexual abuse. There is a video that is trending right now where we see a lady saying that she's been abused and many people, they keep in silence. And then the other thing that they face is also some clients, some people impose to be clients so that they can attack the sex workers because they know sex work industry is criminalized. They have got no way to go and record these kind of cases.
One of
and then
the
around the stigma and discrimination, the stigma is like you face the stigma at the working environment where we are working and the social justice services where you're supposed to get your services and be supported, and you go back to your family, there is a stigma and discrimination. You go to the community, there is a stigma and discrimination. So sex workers, they are the people that face the most stigma and around stigma within their families and around the community, especially the trans sex workers. They face double stigma, being a trans and also being a sex worker.
Constance, talk to us a little bit about perceptions around sex work and how this bill could perhaps assist in that. And, one individual was saying that it's not just about sex work, it's about human rights. But the perception of a sex worker, really not a profession which is deemed in high esteem, a lot of stigma, a lot of discrimination around it, a lot of perceptions, negative perceptions, and the mindset of people around sex workers is that perhaps, why don't you find a normal job that doesn't entail you being on the streets? What do you say to those kind of perceptions around sex workers that, you're doing it at your own risk? Why would you do it?
Right. As we all understand, everybody needs to, they have the family, especially in the black family. We are the black sheep of the family. You need to feed your siblings. And most of the sex workers are mothers. They have children. They need to feed their children. In the limited choices, the limited works that you can see, that you can work, let's say domestic worker, restaurant, sex worker could be the best choice for you, and you say, this is my right choice because the income, to be honest with you, there is a better income, there is better money in the sex industry. So it could be the best industry for you to stick around and work, and you can cover the main people in your, as many as you can, people in your family, and pay school fees and pay rent and do other things like other person. So most of the time it's a job. It's not about the sex work. It's about anything that people think, and we are also like kind of feeding the family, and it's not that the money is used for something else, like any other employee outside today who go and work and come and feed your family and come and support your mother and come and buy your mother medication like everyone else and pay school fees. And then the other thing I just want to highlight, the most important thing why the bill is important. We believe with the decrim bill is going to remove the criminal charges against the sex workers.
Yeah.
If you get arrested as a sex worker, you will be profiled. Once you are profiled, you will have a criminal record. Once you have a criminal record, even though people, they say sex workers are lazy and whatsoever, they have criminal records. With a criminal record, no one wants to employ a criminal.
Yeah.
You got stuck in the industry, even if you want to exit, now you're stuck in the industry. So once the bill is passed, the sex workers, they will be able to remove those criminal charges, and they will be free. They will be free.
Thank you
then the other
very
thing,
much. Unfortunately, I hate to interrupt you. We have unfortunately run out of time, but thank you for your time. Constance Mathe, Asijiki's Coalition National Coordinator, speaking to us there about regulation around sex work.